Okay, wait for the red recording button, and there we are. So we're back to the PowerPoint. Know the bones of the inferior view of the skull. So know these, all of these names and so on. Take note of this one. There'll be questions about the cristagalli and the cribriform plate. That's where the olfactory nerves go through this plate into the holes, the olfactory foramina. That's where the nerves from the cranial nerve number 1, the olfactory nerve, that's where the sensory nerves from your olfactory nerve pick up odors in the nasal cavity. So look at all of these pictures. We all have sinuses. Supposedly they are there to lighten the skull, to reduce the weight of the skull. But recently, scientists have noted that the human skull is getting smaller. That's happening right now. The hyoid bone is a free bone for attachment of muscle. You should know what the hyoid bone is. Make sure you know the coronal sutures and so on, the fontanelles, what they are. In the skull of the infant is born, and these sutures and fontanelles allow the skull of the infant to be compressed so that he or she can make it out of the birth canal. My daughter should be having my first granddaughter, hopefully in a couple of days or by next week. I think probably if she doesn't deliver, they'll induce the delivery. Last we had measurements of the baby we know definitely is a granddaughter, and about 2 weeks ago weighed 7.5 pounds. Here are the parts of the newborn skull. Here's the major fontanelle, which most people are familiar with. So if we go back here, we have other fontanelles besides the one on the top. And so the fontanelles and the sutures allow the skull to be compressed and make it through the birth canal. If you look at a newborn baby, you'll see that the skull has been compressed usually, and it has a totally different appearance that disappears in a couple of days or weeks after delivery. The vertebral column has 7 cervical vertebrae, 12 thoracic. You'll have to recognize these various vertebrae. Okay. Not worried about the curves of the spine. We'll skip that. So you'll know that we have cervical, thoracic, lumbar, and sacral. Those are the various vertebrae that make up the components of the spine. So what does a vertebra look like? It has a vertebral foramina window. It has a body. It has a spinous process. It has a transverse process. So just learn in general the parts of the vertebrae. This is the cervical vertebrae. The cervical vertebrae are much different from the thoracic, which are much different from the lumbar. So we go back here, and we have the sacral So the sacral structure is fused vertebrae. So you should just know in general how many cervical, how many thoracic, how many lumbar, and the sacrum. Know the parts of the cervical vertebrae. Here's the thoracic vertebrae, transverse process, spinous process, vertebral foramen, body. So the thoracic vertebrae has a unique structure based upon the shape of the vertebral foramen and the size of the body. So notice that the lumbar will have all of these same structures, but the shape of the vertebral foramen and the size of the body are much different. So you should know how to identify the parts of the vertebrae and whether it's cervical, thoracic, or lumbar. The first two cervical vertebrae are the atlas and the axis. You should recognize those. Those are the first cervical vertebrae that the skull sits or rests upon, and that allows a movement of the skull. What does the sacrum do? Protects the pelvic organs, articulates with the lumbar vertebrae, and you have your tailbone, the coccyx. We won't emphasize this structure, the sacrum and the coccyx, but you should know its location and that this is the coccyx or the basic tailbone. We won't worry about these parts. We'll have to know how many ribs are attached to the thoracic vertebrae and so on. So we have 7 pairs of true ribs, which have a cartilaginous joint with the sternum. And the parts of the sternum, we should know that. And know that there are 5 pairs of false ribs. So these are the parts of the sternum. Here's the clavicle, and so on. So you should know the parts of the sternum and know that there are 12, what was that, 7 pairs of true ribs and 5 pairs of false ribs. So the true ribs are attached with the cartilage to the sternum. So true ribs 1 to 7. 1, 2, 3, 4, 5, 6, 7. Now notice these false ribs are not connected to the sternum, not connected directly. Know the parts of the clavicle and the parts of the scapula. These will be on WebAssign. So on WebAssign, you'll have to identify these various parts. So the upper appendicular skeleton is the humerus. So the humerus is the upper bone of the arm. You'll have to know parts of that structure. You'll have to learn these parts, olecranon fossa, and so on. So here's the humerus. Make sure you go through all these structures and be able to identify them. The second bone of the arm in a more distal position is the radius. The ulna also forms the lower segment of the arm. So know these structures right here. We're not going to spend much time on the carpals. You should know that these are metacarpals. These are phalanges. We're not going to learn the carpals of the wrist. Metacarpals follow the carpals. The pelvic girdle, you should know the parts of the pelvis. So the iliac crest is right here, and the ilium, the ischium, and the pubis. This is the cartilage that separates the two pubic bones, and this has to stretch during birth in females. Side view of the ilium and ischium and pubis. It's called the coxal bone. There's the interior view of the pelvis connected to the sacrum. The acetabulum is a cavity. The obturator foramen is a hole. So you'll see on what you need to know on WebAssign. The female pelvis is much more rounded, and it has a lot more room for the baby's head to move through the birth canal, and so a baby can be born. So notice the characteristics of a male and a female pelvis. Know the parts of the femur. The tibia and the fibula, parts of those. We're not going to go into much detail on the bones of the foot. I think you may have to know the calcaneus and the phalanges and so on. Classification of joints. I'll stop there. Okay, stop recording. Stop recording.